Hi, my name is Dr. Neha and I'm just going to ask Dr. Minas some questions about heavy periods. As we're all aware, women have a tendency to suffer of heavy periods and this affects their life quite significantly. It causes their work life to be affected as well as their family life to be affected. If you don't mind, could you tell us a little bit more about the causes of heavy periods?
Yes, it's a common problem. Many women face very heavy periods,
Okay.
which can affect both the working lives but also the family lives. And it is no shame to ask for help when becomes a problem. We hear about this kind of problem every day in our clinics, and patients should seek help when they think that it is becoming troublesome. There are a few different reasons which can cause heavy periods. Sometimes we don't find a specific reason. It's how we call it constitutional.
Okay.
That a woman may have very particularly heavy bleeding during her periods by her own nature.
Okay. That's very interesting that you mentioned that.
Yes.
I think it's good for individuals to know about this. So what specifically in regards to symptoms would you say an individual should feel is an abnormal bleeding or a heavy period?
So the reality is that it's a bit subjective. That you cannot put a number or an amount to how much a woman bleeds, where above which you call it a heavy period and below which you call it a normal period. Okay. If it's therefore it's down to the individual, to the woman herself. If she's not happy with if it is causing problems in her daily life, then she should seek help. And I'll come back a bit back to what I was going to mention before, is that some structural problems, so problems like fibroids, for example, or polyps, can often cause heavy periods, and therefore it's important that we pick these problems up when the patients come either to the GPs or to a gynecologist, because we can offer specific treatments when we pick up specific problems that cause heavy periods.
Wow, this is amazing information that you've given us, and it would be fantastic to actually know as well about what treatments are available for this condition.
So there is lots of different ways to manage such a problem. The most common way of dealing with heavy periods is to use a hormonal contraceptive. So medical treatment that means treatment by medication rather than by surgery, is usually the first option, the thing that we try first. And the hormonal contraceptive can help in limiting the amount of bleeding that the woman has. And that could be either a tablet or it could be a coil that's inserted in the womb and stays usually for 5 years. But there are also medications which are non-hormonal, they're not contraceptives, and they can also be used to limit the amount of bleeding that the woman has. But usually when a heavy period is accompanied by heavy pain as well, then a hormonal contraceptive is useful in limiting the symptoms, in making things better. There are surgical treatments for this problem as well, in which we'll talk about in a separate video.
Okay,